everyone. Today we are discussing the topic that is the PCOS and the fertility, and what will be the impact of PCOS on the egg quality. So, what is PCOS? PCOS is nothing but a polycystic ovarian syndrome because this is a very common term nowadays. As per we go by the statistics, around 8 to 30% of the women they are affected by the PCOS. So, what exactly is the PCOS? It is nothing but we call it as an endocrinological disorder. It is a chronic condition because chronic it is said because there is no definitive treatment is available for the PCOS. So, is this really affect the fertility? PCOS is having an impact on egg quality. So, yes, it definitely affect the egg quality. When any couple come to us for the fertility treatment, I can assuredly tell you that 70 to 80% of the women they are having the problem with the ovulation, that is a unovulation, and that unovulation causes a infertility in that couple. So what is the main endocrinological disorder which affect PCO means in egg quality in the PCOS? So what exactly happens in polycystic ovarian syndrome? For that we have to know what is the normal physiological process which happens every cycle. When there is a pituitary hormone, it releases of LH and FSH. It affects on the ovary and the follicle which are available in pre-enteral condition. They start maturing. Every cycle, natural cycle is there. So one follicle it grows. It releases the estrogen which help for the development of the endometrial lining. And when there is a LS surge, which typically occur 24 to 36 hours before the ovulation. So this LS surge and this estrogen which is developed there and these hormones and a low level of progesterone is also there. When we see the graph of the hormones, it is like there is a peak of the LH hormone before ovulation. There is a little peak of progesterone before ovulation, and that trigger the ovulation because ovulation is nothing but the release of the mature ova or the follicle inside the pelvic cavity, which will be catched by the fallopian tube, and ultimately it causes a fertilization in the fallopian tube and the pregnancy happens. So what happened in the PCOS? There is no mature follicle is developed, and that is the reason we called it as it causes a unovulation because ovulation doesn't happen. Why? When we go it at the hormonal level, there is a more release of a LH hormone rather than FSH because there is a defective production of the FSH hormone from the pituitary because there is no any negative feedback from the ovary and there is a more production of the androgen in the PCOS. That androgen hormone we call it as a male hormone, but we require it in the less amount in the PCOS woman. And LH hormone is so much, and that is called we called it as a luteinization hormone in the PCOS woman. So what happens because of the less FSH release, more LH release, that LH FSH ratio get altered and it impact in causing a unovulation. If there is a no ovulation, there will be the no fertilization, and ultimately that couple has to face the infertility. There are two type of the PCOS which we generally see. One is called as the classical PCOS and second is called as the lean PCOS. Now what is classical? Classical means that woman will have typical features of hyperandrogenism. Hyperandrogenism means she is having a male pattern hair loss or excessive hair growth on the face, facial hairs are there, mustache is there. She is having a dark skin near the nape of the neck that is called acanthosis nigricans. There is a hirsutism. There is a obesity. That obesity is typically truncal obesity. That classical PCOS women they are obese and their cycle is irregular, and in future they will face the metabolic syndrome like a diabetes mellitus. They are at a more risk because there is a hormonal imbalance in the classical PCOS. And the second type that is a lean PCOS. Lean means that woman is having a regular cycle but she is thin. She is a thin build and there is no any feature of hyperandrogenism. Means there is no hirsutism, there is no obesity, but that woman doesn't ovulate properly And this lean PCOS women, they also face the infertility because the proper molecular level, if we go, there is a no ovulation in the PCOS. So what will be the screening test? How you will come to know whether you are having a PCOS or not? So there are very simple tests available. There are the criteria accordingly which we diagnose. First is the sonography that we do. That is, we called it as a pelvic scan. In the sonography, your ovary shows a typical pearl-like appearance at the outer margin, and the follicle will be more than 12 size, means if antral follicular count is more than 12 and the range of the follicle size is between 2 to 9 and it typically shows a necklace pattern in the ovary, so we label it as a polycystic ovary. And the second is level of AMH. If the AMH level is so much, means the normal AMH level in the reproductive age, we can call it 2.5 to 3.5 ng per ml. But if it is more than 9, if it is more than 12, then that woman is having a definitely polycystic ovarian syndrome. Because what happens in the PCOS, there are multiple follicle forms from the preantral follicle, but they don't get mature and it shows a cyst like appearance in the sonography. We called it as a necklace pattern, and that doesn't ovulate because of the insufficient hormones and because of the increased level of LH hormone, because of the androgen which is available in that PCOS woman, it doesn't ovulate. So these are the two criteria. If we will do the hormonal assay, like a screening test, we can say we can do the FSH level, we can do the LH level, serum prolactin, serum thyroid stimulating hormone, that is the TSH, E2 level we can do. And there are sometimes some genetic conditions are there, like 17 hydroxyl deficiency. In that we do this hormonal assay, and typically there is a lipid HDL ratio is decreased because PCOS causes a dyslipidemia, increased cholesterol level because of the obesity that causes the anovulation in the PCOS woman. So all these factors definitely affect the egg quality and it causes a anovulation. So what is the treatment? What exactly? So it is very simple, because what this increased androgen and inadequate FSH, this suppresses the ovarian follicular maturation. So the treatment is, we should give the wholesome approach, because this is a chronic disorder. It's not like a acute disorder ki you take a medicine and it will totally resolve. It will never resolve because it is a lifestyle disorder. Some article they shows ki the predisposition factor is a genetic. Sometimes if your mother or if your sister is having a PCOS, you are at a more risk of developing the PCOS. That is the one. And second thing is your lifestyle. Lifestyle means if you are having a more junk food, if you are having less exercise, more sedentary jobs are there, then these all factors lead to the PCOS. So whenever any woman she comes with a PCOS, the first and foremost we tell the patient to go for a lifestyle modification. You don't have to go for a gym or anything, but a daily exercise like a simple walking for a 30 minutes will definitely help the PCOS woman, because because of the reduction of the fat, because of the reduction of the cholesterol, it definitely helps the quality of the ovulation, and it is proven in so many studies. Second, your diet. Whenever there is a dietitian is there which always tell you about the calorie intake, about the healthy food, and for the women who are at a home or something like that who doesn't follow. So a simple like you should avoid a rice, you should avoid a sugar, a high calorie with a high glycemic index food you have to avoid. Take a more fiber diet, take a high protein diet, that will definitely help for the ovulation. There are certain foods which helps in increasing the quality of egg, but it is not 100% proven कि after having this food, the ovulation will start its own. But when you do the wholesome approach like a diet and the exercise, this will help the PCOS woman for the ovulation. And the treatment part, when you are planning for your pregnancy, so the treatment part is simple, that is the ovulation induction. So ovulation induction we generally give by the medicine, that can be the oral medicine, and we have to do the follicle monitoring. The follicular monitoring will tell you whether there is ovulation is there or not, and that will help to get conceive the PCOS woman. And in some times there is a resistant PCOS is there. So that couple, and if any other factors are available, that if that lady is a morbidly obese, there is a endometriosis is also there. There is a fallopian tube factor is there, tubal blockage. So the ultimate solution is the IVF, because what happens in vitro fertilization, the follicle which we stimulate, we can see under the microscope whether they are getting mature or not. The quality of egg can be commented during the IVF. It get mature outside the body, and we make a good embryo, and that will implant inside the uterine cavity. So there is no role of fallopian tube, there is no role of having a less mature egg or something like that. So IVF is the one of the good solution for the PCOS woman. But definitely when there is no any other factor, a young woman is there, fallopian tube is good. So a simple ovulation induction is there, and which can help the PCOS woman to get pregnant. Definitely, and to get a naturally ovulate. That is a challenging for the PCOS woman, because I have initially also explained what exactly happens at the hormonal level, and to control that hormonal level you have to do a major wholesome approach, diet, exercise, and the medication, and that will help. So if anyone is having questions related to the PCOS, you can ask me. Can we have dairy product like curd if I have PCOS or PCOD? Yeah, definitely you can have the dairy product. Only the thing is, when you are diagnosed with the PCOS, you should cut down your calories according to the dietitian. And the second thing is, you should have the healthy food at home, like high fiber diet or curd or milk, that you can have. Only the junk food you have to avoid. Is skin pigmentation in knee and neck of symptom of PCOS? Yeah, the skin pigmentation is there. When I told in the classical PCOS, there is a darkening around the neck, there is a darkening around the knee, and that is nothing but a insulin resistance is developed in the PCOS woman. There is a endocrinological disturbance which occur at the level of pituitary, which occur at the level of ovary, and there is a more production of the fat, which causes ultimately increased production of androgen, and that causes a typical darkening in the PCOS. Are there any specific supplement or diet recommendation for PCOS? Yes, we generally give tablet which are having a multivitamin. It is proven that vitamin D3 and the amino acids and the contents like omega acids, these are helpful for the PCOS woman. Diet is definitely the main factor to manage the PCOS, and supplements like we generally give PCO care, so that will taken care of all the multivitamins which are required for making a good follicle. Okay, so this is the helpline number which is available on the screen. If you have any doubt regarding the PCOS or the any fertility issue, please visit me at the Oasis IVF Center, Wakad, Pune. Thank you so much.